Hi, I'm a pediatric optometrist and I'm going to show you how to improve amblyopia with using an eye patch. Treat amblyopia as young as possible since vision is developing fastest before age 7. If a 2-year-old patches for 30 minutes a day, they may get faster results than waiting until they're 4 years old and more cooperative. Usually patching is recommended 2 hours a day if their vision is better than 20/80 and 4 to 6 hours if it's worse. If your child refuses to patch, ask your doctor if prescribing 1% atropine eye drops once a week in the good eye is a good option for them. It's important to monitor your progress with your eye doctor. Sometimes vision may change due to a change in glasses prescription or eye health, so usually I check vision every 3 months to make sure the treatment's working. First, decide which patch works best for your child. It's easy to buy many types of patches online. Total occlusion refers to a patch that completely blacks out the good eye. This is necessary where the vision is really bad in one eye, like less than 20/80. Types include adhesive eye patch, pirate patches, or patches on glasses. Adhesive eye patches are like band-aids that you stick on the eye. These are the best for infants and toddlers because they're difficult to remove. If it causes irritation, you can stick the patch to your arm first to make sure the adhesive is less sticky, or put a little chamomile lotion or milk of magnesia to the skin. Let it dry before applying the eye patch. Or you can cut a piece of the patch where it causes the irritation. A pirate patch is cheaper and less irritating, but it's much easier to move to the side so children can peek out of it, so you have to watch them closely. If your child wears glasses, I recommend this eye patch that fits on the glasses, but you have to make sure that glasses are close to the eyes and they cannot peek out of it. I recommend these hooks to keep the glasses close to the eyes as well. Often, doctors start by recommending an eye patch that totally occludes the good eye, like an adhesive or cloth patch, to improve the vision in each eye individually. But the eye under the patch may turn in or out more, which doesn't improve the strabismus. To improve the strabismus or ability of the eyes to work together as a team, a blur patch or red-green glasses, as I show in my next video, can help. A blur patch is something that blurs the vision in the good eye. For example, scotch tape or petroleum jelly on the inside of the lens. After patching, remove the tape and clean the glasses with a drop of dish soap. Ask your doctor if the cloudy tape or 1 to 2 3 layers of the clear tape is best for you. In strabismus, it helps to monitor your child's eye under the blur patch to see if it's turning. Blur patch often have to be monitored more closely by your doctor to ensure they are blocking the vision in the good eye enough to improve the lazy one. It's important to spend special attention to making wearing an eye patch a positive experience in the beginning. At first, it's hard because often the eye is weak, so it feels tired and uncomfortable to use. A child may feel scared because they feel like they can't see anything out of that eye. It often takes 15 minutes for the brain to switch on that eye. So, here are some tips to ensure you are successful with patching. Determine which adult will be responsible for monitoring patching and patch the same time each day to form a habit. Record the time each day they were successful and give them a sticker. You can break it up an hour in the morning and an hour at night. Give them an option which patch they prefer to wear. Ask if they want to decorate it. Remind your child that you are patching to improve their vision. Get books to explain to them why they're doing it. Play with them a lot, especially at the beginning. Set a timer and tell them if they make it to the end without taking the patch off, they get a reward. For example, 20 minutes of video games. But a minute is deducted every time they take off the patch. Consider wearing an eye patch with them, at least at first, to show them it's not that bad. Play with a special game or toy to distract them and give them a reward if they make it to the end of the timer. Thanks for watching. I hope this video helps you and your family. For more informative videos about your eyes, click like and subscribe.